Christina Grosso has an extensive background. She has taken on the role of clinician, supervisor, educator, leader in nonprofit mental health systems. As the founder of Mind Plus Body Equals One, Integrative Mental Health and Optimal Performance, LLC, she continues her mission to destigmatize mental health. Her approach integrates psychotherapy, psychophysiology, and creativity, offering services such as individual therapy, biofeedback, and optimal performance training for athletes and executives. Take it away, Christina.
Thank you, Dean Moss. It's my honor and privilege to be with you tonight and share my doctoral research exploring the relationship between creativity and resilience. The doctoral journey is a humbling one, especially as a full-time clinician, mother, and student during the COVID-19 pandemic. And I am forever grateful to the Saybrook community, my mentors, my faculty and peers, and my family, for without them, this journey would not be possible. So my interest in this topic emerged from my work as a community mental health leader during the COVID-19 pandemic, where I experienced the evolving needs of mental health care professionals responding to the crisis. And during this time, leaders needed to respond to the ongoing cumulative impact of stress. And the typical self-care strategies to mitigate secondary traumatic stress, or STS, was not enough. And I found myself and my staff overwhelmed, exhausted, and burned out. And as an artist and art therapist, I used painting and drawing as a daily practice to process the events of the day. I have included some of my artwork throughout the presentation that I created during this time. And I found this creative time, healing and clarifying, often leaving my creative practice with new ideas and perspectives to the problems of the day. And I wondered how creativity could be used to foster resiliency for other leaders and mental health care professionals impacted by the strains of the work, as well as how creativity could serve as a protective factor in the prevention of STS. Overall, I found the response model could no longer be reactive, but we needed to adapt to navigate the volatile, uncertain, complex, and ambiguous environments that were emerging. The COVID-19 pandemic revealed inadequacies in healthcare systems and the emergence of VUCA environments, this volatile, uncertain, complex, and ambiguous environment. US healthcare providers were overwhelmed, operating without predictable and collaborative resources, and issues of STS, which existed prior to the pandemic, were increased, leading to burnout. And mental health issues drastically increased due to challenges of isolation, stress, and economic strain, placing amplified burden on mental health providers who were simultaneously navigating the changes in the delivery of care, so going from in-person to Zoom-based sessions or telehealth sessions, navigating their client care and their own pandemic-related stressors. And responding to these changes require flexibility, adaptation, and problem solving. And mental health has also not traditionally been a central mission within the public health workforce. And due to current findings on the intersectionality of emotional well-being and mortality, mental health providers have become critical in promoting national health. And the need to identify characteristics and practices that build resilience in providers is critical to create a healthy, effective, and sustainable workforce that can adequately address the growing needs of our nation. The purpose of this dissertation study, which I actually completed in the spring of 2024, was to explore the predictive relationship between creativity and resilience in 171 mental health providers who experienced VUCA during the US COVID federal health emergency period. And that period that I'm talking about is the length of time from January 31st, 2020 through May 11th of 2023. And the goal of the study was to determine the relationship between creativity and resilience, and to identify relevant factors that contribute to resilience, which might mitigate secondary traumatic stress in mental health providers. So I had a number of research questions, really all stemming from this central question of what is the predictive relationship between creativity and resilience? And within creativity, what about it? Was it creative thinking and problem solving? Was it task creativity? Did task creativity, someone's own personal exploration of drawing, painting, making music, dancing, moving, crafting, did that impact resilience? And what was the relationship between the professional quality of life of that provider and resilience? And did secondary traumatic stress moderate the relationship between creativity and resilience? And furthermore, what factors of creativity related to resilience building? So I'm going to walk you through a brief overview of my theoretical foundation, but I really want to spend most of the time getting into the results. So this is a visual of my framework looking at literature on VUCA and COVID-19, looking at professional quality of life literature, specifically around compassion and negative effects of secondary traumatic stress and burnout, looking at creativity and resilience. So overall, a little bit of a deeper dive into the research. The term VUCA was coined in the 1980s following the Cold War. And this was really used to describe changes to geopolitical volatility. And following the declaration of COVID-19 as a global pandemic, this started to give rise to volatile, uncertain, complex, and ambiguous environments. And unprecedented strain was placed on the mental health care system and on our providers. And mental health providers were traditionally marginalized from medical response efforts. Literature reviewed also included theories of compassion satisfaction, so things such as mattering, effectiveness, contributing to the greater good, and literature on secondary traumatic stress, burnout, institutional betrayal, and related symptoms of cynicism, exhaustion, ineffectiveness, and hopelessness. And the capacity for resilience was described within the framework of how someone adapts positively to quickly changing environments and situations. So resilience in the context of provider care was about provider well-being, provider self-care, the ability for support and creativity. And creativity was introduced as a mechanism for creative thinking, agility, adaptation, and fostering resilience. I also conducted a methodological review to help guide me on what types of research to engage in within my method. And most commonly, quantitative design studies emerge with correlational analysis and descriptive statistics and regression analysis. Gaps that existed as I began this literature review were namely in the areas of there was a scarcity of published research between creativity and resilience. And despite the presence of creativity in the literature, there was a shortage of research in mental health, viewing creativity as a predictive variable for resilience. There were predictive relationships evident between resilience and creativity. However, there was no discussion of how creativity could predict resilience. And the result of the review of the literature also indicated a lack of published research addressing the role of creativity in navigating VUCA environments. Most published research focused on medical professionals, namely nurses, with very little focus on mental health providers. I used a quantitative method and a descriptive, predictive, exploratory, correlational design to examine the research questions. So looking at my method, in this study, I examined the association and predictive relationships through the administration of an online survey. This survey I used a census and snowball sampling technique where data collection comprised of distribution through Qualtrics. I distributed the survey via email to various listservs of mental health providers. I also used social media posts such as Facebook and LinkedIn, and advertised in various newsletters. And I used a snowball sampling technique, which basically means that once a provider got the survey, they were free to then share it outward. My inclusion criteria were that people needed to be employed as a mental health provider, working directly or indirectly with clients. They needed to provide mental health services. They needed to work within the United States, and they needed to work during that federal emergency period, that period from January 2020 through May of 2023. Exclusion criteria was being employed in a job where duties were not mental health specific. So someone such as a general medical provider, a first responder, a teacher were not qualified to complete the survey. Anyone working outside of the US and anyone not working during that federal emergency period. The survey questionnaire consisted of demographics, Likert type questions pertaining to VUCA, questions regarding professional quality of life, secondary traumatic stress, and task creativity. I also included measures, validated measures of the Reisman Diagnostic Creativity Assessment to measure creativity, and the Connor-Davidson Resilience Scale to measure resilience. Data analysis consisted of descriptive and inferential statistics. I will kind of walk through more of the results of this than getting into each analysis I used, but parametric and non-parametric analysis was used, including multiple linear weighted regression to examine the predictive relationships between variables. So further details will be discussed now. So characteristics of the sample, the current study yielded 171 participants. Those were completed surveys. I actually reached a larger yield, but all of the surveys were not complete. So 171 completed surveys. The majority of the sample were between the ages of 40 and 54, with more than 16 years of experience in the field. Most were white or Latina women. Most of the sample were licensed master's level and doctoral level psychotherapists. Clinicians, clinical supervisors, and creative art therapists represented the largest groups, and private practice and community mental health centers were their primary workplaces. 32%, over 32% were NCTSN affiliated. This is a federal organization mission to treat child trauma in the US. The focus of this current study addressed a gap in the literature where prior studies focused on leaders in industry and medicine. Despite the importance of leaders' perspectives, there's a lack of published studies focused on direct service of mental health providers. And in this study, participants held various positions of direct and indirect service, reflecting a more diverse sample than earlier studies. Creative art therapists represented more than 14% of the population, which may affect the results of the creativity scores in the current study, as creative practices and mindset are inherent in this population. And the study extends the research on this population beyond earlier studies that really focused mostly on early stages of the pandemic, and on international population, whereas this study was based in the US and looked at both during pandemic and immediate post-pandemic experiences. So I'm going to walk you through some of the findings regarding the experiences during COVID of VUCA, professional quality of life, STS, and task creativity. Prior to this study, there were no published methods to measure VUCA. I created specific questions to address the individualized variables of VUCA and a scoring sum to represent the total, allowing for specific independent analysis of each component. The diagram depicts the percentage of the population that strongly agreed to VUCA. So for instance, 44.4% of the population strongly agreed to experiencing volatility. 57.9% strongly agreed to experiencing uncertainty. 58.5% strongly agreed to experiencing complexity, and 61.4% strongly agreed to experiencing ambiguity. The center blue circle represents the combined VUCA variable, which represents the summed responses from each participant, indicating a cumulative experience of volatility, uncertainty, complexity, and ambiguity. And this score, this mean score of 20.83 out of the maximum of 24, indicates that mental health providers experience the pandemic as a VUCA environment. This chart includes some frequency distributions for positive professional quality of life, negative professional quality of life, STS, and task creativity. The majority of participants occasionally experienced positive professional quality of life. And this is that sense of compassion satisfaction, sense of purpose, increased productivity, mattering, and contributing to the greater good. The majority of participants frequently experienced negative professional quality of life. And this pertains to fatigue, burnout, concepts of institutional betrayal, or moral injury. The majority of participants occasionally experience secondary traumatic stress. And the results of task creativity were multimodal, with most of the sample reporting occasional and frequent engagement in creative activities. Again, task creativity is that personal creation of art, movement, music, etc. Further analysis was conducted, a Spearman's row, to examine some correlation coefficients. So I'm going to review the major findings here. A significant negative correlation existed between positive professional quality of life and negative professional quality of life. So what that basically means is that as the positive professional quality of life increased, the negative professional quality of life decreased. A weak negative correlation existed between positive professional quality of life and secondary traumatic stress. So this makes sense. As more positive professional quality of life increased, it decreased secondary traumatic stress. A moderate correlation existed between negative professional quality of life and STS, whereas negative professional quality of life increased, STS increased. The results of the study confirm earlier studies by demonstrating that mental health providers can experience a positive professional quality of life during VUCA environments such as COVID. And the relationship between VUCA and negative professional quality of life was significant, suggesting that mental health providers who experienced VUCA were likely to have experienced negative effects of work-related stressors. And the relationship between VUCA and secondary traumatic stress was significant, indicating that mental health providers who experienced VUCA were likely to have also experienced secondary traumatic stress. So looking now at the post-pandemic period, this creativity and resilience was measured after that final day of the federal emergency period. And the RDCA looked again at creativity, the CD risk looked at resilience. And what we saw in creativity was that there was a mean score of 101.84, indicating moderately high levels of creativity during that immediate post-pandemic period. The CD risk was administered, and we saw that the mean score here was 74.66, indicating that mental health providers demonstrated resilience in the post-pandemic period. An interesting study had come out that had showed physicians who actually scored in the bottom 25% of the general population. Mental health providers in this study represented the bottom 50% of the general population. The physician study came out in 2021, and the physicians actually demonstrated less resilience than the mental health providers demonstrated post-pandemic, which I think is a really important piece to recognize. And looking at the results, the current study indicates that mental health providers who experienced VUCA during the pandemic displayed post-pandemic resiliency or positive adaptation to stressors. Working through the questions, the research questions that I brought up earlier, the results of the study supported the conclusion that creativity predicted resilience, that creativity was a contributing factor to resilience. Prior studies identified resiliency contributed to creativity. And in this study, the inverse finding was actually found that creativity predicted resiliency in this population. Mental health providers experienced high levels of VUCA during the pandemic and high creativity in the immediate post-pandemic period, suggesting that VUCA during the pandemic may have contributed to the resilience of mental health providers. In prior studies, VUCA environments created adverse conditions that decreased leaders' adaptive performance and creativity. And in this study, it actually disconfirmed those findings, indicating that VUCA environments correlated to moderately high creativity, demonstrating that as VUCA increases, creativity increases. And the creativity of mental health providers predicted their resilience, implying that they were maybe more adept at navigating and adapting to changes, which could be a very critical aspect of resilience in dynamic environments. Creative tasks significantly predicted resilience, indicating that the more mental health practitioners engaged in creative tasks during the pandemic, the more resilient they were during that post-pandemic period. And this supports the conclusion that task creativity is a method to positively adapt to adverse or traumatic experiences. As art therapists, I think we knew this intuitively, and it was really exciting to see this in the research, that creative expression, whether through art, writing, or other outlets, provides individuals with constructive ways to process emotions and cope with stress, and that creative tasks are resiliency building endeavors that could be fostered as best practices. Mental health providers experience positive professional quality of life, or those positive effects of work-related stressors, such as compassion, satisfaction, and mattering. In prior studies, positive effects of compassion were experienced in response to stressful events. And the results of this study confirm those findings and extend the theory to include that the experience of VUCA may have prompted mental health providers to develop and employ effective coping strategies to manage their own well-being, support their colleagues, and deliver care to clients in challenging circumstances. There was a negative correlation between secondary traumatic stress and resilience. And secondary traumatic stress did not moderate the relationship between creativity and resilience. And this finding further supports that creativity as a predictor of resilience, even when providers have experienced secondary traumatic stress. More creative individuals are better able to bounce back from adversity or stress, even when they have experienced STS. Various subfactors were identified in the regression that indicated that 10 subscale factors significantly correlated with resilience. And I'm going to walk you through some of those and what they mean. So the results revealed a strong positive relationship between intrinsic motivation and resilience. And intrinsic motivation comes from those internal factors such as personal values or a sense of purpose. It also, the analysis also revealed moderate relationships between the various subfactors and resilience. So these moderate relationships are in the kind of middle blue, medium blue. So risk-taking, flexibility, tolerance of ambiguity, which is the ability of an individual to feel comfortable within certain situations, conflicting information, a lack of clear direction, essentially accepting ambiguity without feeling stressed or needing immediate closure. Significant between divergent thinking and resilience. And divergent thinking is where a person can kind of come up with a wide range of creative ideas or solutions in problem solving, that there's not just one correct answer, there's many different solutions. Originality, fluency, kind of the ability to generate a large number of ideas or solutions in a short amount of time. Resistance to premature closing, which really relates to the ability to maintain an open mind and consider multiple possibilities instead of jumping to conclusions. And convergent thinking. And convergent thinking is more applying logic and analyses to problem solving. And regression results indicated that flexibility, intrinsic motivation, and risk-taking significantly predicted resilience. So besides just having a relationship, there was a predictive relationship, meaning that in other situations, these factors could predict resilience. And interestingly, there was no significant relationship found between extrinsic motivation and resilience, which I personally found very interesting as a mom and as a therapist, that these outside rewards or motivators were not as powerful in generating resilience than the intrinsic factors. The intrinsic factors were at the strongest, whereas the extrinsic motivation did not show any positive relationship. So these 10 subfactors of creativity that were identified by the RDCA significantly correlated with resilience, creating a new paradigm for identifying predictive factors of creative resilience. These factors create a comprehensive framework for understanding creative resilience. Tolerance of ambiguity provides the foundation for navigating uncertainty, while divergent thinking, originality, resistance to premature closing, and elaboration contribute to the development of innovative and adaptive responses to challenges. By integrating these elements, individuals can cultivate creative resilience, enabling them to thrive in these VUCA environments. So just quickly to review some implications, the combined VUCA variable is something that was created in this study and could be used for future research. I am imagining VUCA environments will continue to arise, and this particular framework could be helpful in identifying VUCA in other environments. As discussed, the application of VUCA as a theoretical model has not been widely researched, and this study confirms the finding of VUCA environments specifically identified within COVID-19. And when we look at the correlation between VUCA and creativity, it contradicts the existing theories that VUCA environments decrease creativity. And so this idea of this creative resilience is emerging as a potential method for problem solving during adverse times. And creativity as a predictor of resilience suggests that fostering creative mindset may serve as a protective factor against burnout, helping professionals navigate the demands of their work without succumbing to exhaustion, and overall can contribute and to their overall well-being as well as the well-being of their clients. Thinking about this on a training and supervision level, within leaders and systems of care, if we can increase creative thinking and task creativity, could we also help systems become more sustainable? Also helping our systems and our staff engage in creative problem solving to navigate crises. Further integrating creative approaches into training can help prepare individuals for their profession, namely creating an avenue for accessible self-care strategies. So once you teach these principles can be replicated and people can use them on their own as an ongoing and sustainable method of self-care. And when we think about creativity and mental health providers, the more creativity that's engendered, it can help develop and implement innovative treatment approaches. Innovation can lead to discovery and novel interventions to address the complex needs of the clients. The implications of the current study have practical significance for various stakeholders, including practitioners, policymakers, and the broader community. And understanding the relationship between creativity and resilience can have implications for personal development, for education, for mental health intervention, and organizational practices. Fostering creativity may not only enhance one's ability to generate innovative ideas, but also contribute to building the resilience in the face of life's challenges. As in any research study, I encountered some limitations. To kind of name, I think the top one, there was really an insufficient sample size to do a full factor analysis or a hierarchical regression where we could really look at every single sub-factor of each of the factors I presented. So for instance, there are many things that contribute to tolerance of ambiguity. And having a larger sample size, you can actually really look at each one and see which ones are really kind of driving the train toward resiliency. Temporality of COVID was also a limitation. I did my data collection in June and the very beginning of July. The pandemic ended at the end of May. So people really needed to reflect back on their experiences during COVID. And again, that could really affect, some of their positionality. Eternal validity with correlational design is low, so this study may reflect other relationships naturally existing within the world. And I think the homogeneous sample, even though I did do some census sampling and snowball sampling techniques to strengthen this external validity, we have a sample of primarily white practitioners. Anecdotally, this is a little representational of the field, but homogeneous samples have a, there's limited generalizability to the larger population. And I did not collect location data from my URLs. So that basically means I don't know where in the US these participants were from. And again, we know the US is a very diverse nation of geography, culture, and socioeconomic factors. So without location data, we may not be able to really capture those regional nuances, in opinions or behaviors. So ideas for future study. I found that there is, a lot of promise and a lot more questions that have come from doing this study. I think replication studies would be really wonderful to do with a larger sample size, potentially collecting data during real time events so that the data was really collected in the moment and as sort of accurate and in time as possible. Would love to see the extension of VUCA or the study of creativity and resilience in other non-COVID environments. And I think as we look forward to various studies, we can also look at comparative design, looking at like what type of creativity or task creativity really yields resilience, and how we can train providers and what really is going to work. But I think the take away from this is that the creative subfactors of creativity and resilience, the detailed research to really look at that predictive factor within flexibility, intrinsic motivation, and risk taking, which really emerged as the hallmarks of creativity and resilience, and identifying how these attributes could be taught to providers and leaders and systems to promote resilience and to promote sustainability, I think is really critical, and to further strengthen our healthcare system and prevent finding more and more possibilities to prevent secondary traumatic stress. So thank you for listening. I know a lot of data in a quick amount of time. Happy to answer any questions you may have.